Partnering to meet the global 90-90-90 targets in Zambia, the America International Health Alliance and the Zambia Defense Force ACT initiative. With proper treatment, HIV has become a chronic disease for many, and Zambia is on track to achieve the global 90-90-90 targets. To reach the targets, it's critical for people living with HIV to remain in routine care. When patients miss their appointment to meet with a counselor and pick up medication, they are considered lost to follow-up. The Zambia Defense Force plays a substantial role in the country's response to HIV. Their 54 military bases provide health services, including HIV-related services, to more than 400,000 active members of the military and civilians. In September 2016, the American International Health Alliance and the Zambia Defense Force piloted a patient tracking mobile application known as iPhone Builder to reduce loss to follow-up among children and their mothers. Here's how it works. The facility health worker inputs a patient's contact and demographic information along with the upcoming appointment date into the app. The facility worker then assigns the case to a community health worker. The community health worker receives a notification about the patient's upcoming appointment via mobile phone. Using the information provided, the community health worker reminds the patient about the upcoming appointment. When the patient attends the appointment, the facility health worker notes that in the app, and the entire process repeats itself ahead of the next appointment. If a patient misses an appointment, the facility health worker follows the same general steps, but indicates that the patient has missed an appointment and is lost to follow-up. The app sends notification of the missed appointment to the community health worker, who then contacts the patient to determine why he or she didn't make it to the clinic and reports the reason in the app. The facility health worker receives this information and can proceed as necessary to reschedule the appointment or remove the patient from the records.
With the coming of the American International Health Alliance on board, we're privileged to have the iPhone tracking system, which has actually helped us and is still helping us in reducing the numbers. Like in the time past, we could have lost to follow-up going up to 1,300 plus. The challenges that we've been facing before the introduction of the iPhone Builder, that we were unable to track the patients who could have absented themselves from the scheduled appointments. It was really difficult even for our community health workers to go out there to track these lost to follow-up clients.
With the coming of the app, it has really assisted us a lot, because we would call those clients to find out what's happening, why they're not coming for clinical follow-ups, for labs, or for research, for pharmacy activities. So when we call them, they feel part of us. Some, they wouldn't even have excuses for the reason why they're not coming. But us calling them, it would be like, wow, these people care so much.
It has actually assisted us, because most of the time that we've called these patients back to care, they usually come back to treatment and care. The experience, it has been overwhelming from the parents, even from the patients themselves. They've made me like their auntie. Sometimes I just call them to find out how they are doing, and they are so happy. Last time we had a meeting with the parents, and they were really appreciative of what we are doing to the children. That sometimes we even bring, like, for children who give up, I would get someone like who is an example to them, to inspire them, someone who had stopped taking drugs, and we brought them back, and then they are going to give a testimony to them, to tell them the importance of taking medicines.
Because it has really helped us in tracking the lost to follow-up clients. As I'm saying, we are looking forward to reach a situation where we'll have no loss to follow-up at this facility. This will in turn make us have a viral load surplus because we'll have clients back in care. And I foresee this facility performing well and reaching or getting rather closer and closer to the 90-90-90.
The patient tracking pilot demonstrates promising results. It allows facility and community health workers to share information with each other in real time. It has already enabled health facilities to identify many patients lost to follow-up and bring them back into care. The project has yielded better patient linkages to both community and facility-based care and has saved both time and money on patient care. It has also allowed community health workers to serve more clients, while at the same time helping clinic staff update or purge many patient files. Once sufficient data on loss to follow-up has been collected, AIHA will work with facility and community health workers on behavior change communication activities to ensure more patients are retained in care.